Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, over the last few months I felt unusually fatigued and off balance. It's like I don't have my normal energy levels, and sometimes I just feel cold when others are comfortable. I've been using extra blankets at night just to feel warm.
I understand that must be quite uncomfortable for you. Can you tell me more about these symptoms? How long have they been occurring?
It started subtly around 5 months ago, but has become more noticeable over time. The fatigue is there most days. It's not like I'm just tired. It's more like I'm drained, no matter how much I rest. As for feeling cold, I've noticed that even during mild days, I need a jacket and sometimes even a hat indoors.
Has there been any change in your daily routine or stress levels that might explain these changes?
Not really, doctor. My routine has been quite consistent. I thought it might be the aftermath of my radiation therapy for prostate cancer, but that ended last year. My cancer is currently under control, with the PSA levels being very low, thanks to the treatments and ongoing monitoring.
That's good to hear regarding your cancer treatment. What about your balance issues? Can you describe those instances?
Sure, it's like I suddenly feel unsteady on my feet. There have been a few times I nearly fell, but managed to catch myself. There's no spinning sensation, just a sudden feeling that I might tip over. It's quite unsettling.
I see. And have you noticed any patterns or specific times when these balance issues occur?
Not specifically, it seems random. Sometimes when I stand up too quickly, or when I'm walking through a doorway. It's odd and random.
Thank you for sharing that. It's important for us to understand as much as we can. Let's discuss your weight management as well. I see there's been a significant increase over the past year.
Yes, that's been frustrating. Despite trying to watch what I eat and maintaining an active lifestyle, I've gained quite a bit of weight. It's been difficult to manage, and I'm concerned about how it's affecting my overall health.
Weight management is certainly important, especially with your history of diabetes and cholesterol management. Have you made any dietary changes recently?
I've tried cutting back on sugars and fats, focusing more on vegetables and lean proteins. But it seems like my metabolism just isn't what it used to be.
I appreciate your efforts in managing these aspects. Let's take a closer look at all your symptoms and see how we can address them. I've reviewed your recent lab tests and clinical measurements. Your hemoglobin level is stable at 12.7 gram per deciliter, which is good. Your echocardiogram shows normal heart function, and there are no signs of anemia or thyroid dysfunction that could explain your fatigue or cold sensitivity.
That's relieving, but also confusing as to what could be causing these issues.
Absolutely, it can be puzzling. Your kidney and liver function tests are normal, which is excellent. Your blood sugar and cholesterol levels are also well controlled with your current medications. However, your vitamin D levels were a bit low, so it was good to adjust that. We'll need to continue monitoring and possibly adjust further if needed.
I understand. Do you think my current medications could be contributing to any of these symptoms?
It's possible, especially with the complex interactions between medications. However, your medications haven't changed significantly recently to directly correlate with the onset of your symptoms. Still, it's something we should keep in mind as we proceed.
So what would be the next steps to figure this out?
Firstly, I would recommend a detailed sleep study to evaluate for sleep apnea, given your snoring and the potential for it to contribute to your fatigue. We should also continue to monitor your blood pressure and blood sugar levels closely. Given the balance issues, a referral to a neurologist might be necessary to rule out any neurological causes. We'll do some more tests, including checking your iron, B12, and folate levels to address the possibility of other nutritional deficiencies.
That sounds thorough. I'm glad we're looking into all possible causes.
Absolutely. It's important we cover all bases. I'll also schedule a follow-up appointment for you in 4 months, but please come in sooner if your symptoms worsen or if you have any concerns in the meantime.
Thank you, doctor. I appreciate you helping me figure this out.
You're welcome. It's important to me that we get to the bottom of this so you can feel better. Let's stay proactive and in touch.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. It's good to see you back, although I wish it were under better circumstances. Let's start with what brought you to the emergency room recently. Can you describe what happened?
Hello, doctor. Yes, it was quite unsettling. I was just sitting down for a cup of coffee and suddenly I felt this intense sensation in my chest. It wasn't painful like a stab, but more like a heavy pressure that wouldn't go away. It scared me enough to go to the ER.
I see, and did this sensation spread anywhere else, like your arms or jaw?
No, it stayed right in the center of my chest. It lasted for about 10 to 15 minutes and then slowly faded away.
Okay, and how have you been feeling since that episode?
I've been a bit anxious about it happening again, but no, nothing like that since then. However, my heartburn has been terrible. It's almost daily now. I get this burning sensation after I eat, and sometimes it's so bad after meals that I have to take a moment to catch my breath.
You mentioned that you stopped taking omeprazole, which had been effective for your heartburn. What led to you discontinuing it?
I was feeling better and thought maybe I didn't need it anymore. Plus, I heard about some long-term side effects that worried me.
Understood. It's important to weigh these concerns. We'll discuss a plan for managing your heartburn effectively with medications and lifestyle changes shortly. Now, tell me more about your sleeping and urinary symptoms.
Well, the sleep has been rough. I wake up suddenly feeling anxious and can't get back to sleep. As for urination, it seems I'm going to the bathroom more often than usual, especially at night.
Have you noticed any changes in the stream or difficulty starting urination?
Yes, actually. It feels less forceful, and sometimes I have to really concentrate to get started.
These symptoms can be common with age, but we should monitor them closely, possibly evaluating for prostate issues if they continue or worsen. Now about your sinus issues and anxiety. How are these currently affecting you?
My sinuses are always a problem, especially in winter. The sprays help a bit. As for the anxiety, it's manageable, but I avoid crowded places like the church now because I feel trapped and uneasy.
I appreciate your openness in sharing these challenges. Managing anxiety without medication can be difficult, but we'll keep an eye on how you're coping. Let's review your recent health results and discuss the next steps. Your blood pressure today is 138/85, which is a bit elevated. Your heart rate and respiratory rate are within normal ranges. Your lab results show stable kidney function and cholesterol levels, though we should aim to improve your HDL cholesterol. The prostate-specific antigen level is within the expected range for your age, but we'll monitor it along with your urinary symptoms.
That sounds thorough, doctor. What do you suggest going forward?
First, we'll restart omeprazole to manage your heartburn. I also recommend a diet free from tomatoes, citrus, caffeine, and spicy foods, as these can exacerbate your symptoms. Given the severe chest sensations you experienced, a Holter monitor to continuously evaluate your heart rhythm over a few days would be prudent. We should also consider a sleep evaluation to address your nocturnal awakenings and a routine check for prostate health due to your urinary symptoms.
And the sinus and anxiety issues.
Continue using the nasal sprays as prescribed. For anxiety, I would recommend monitoring your symptoms for now. If they worsen, we could consider reintroduction of medication or referral to a mental health professional. We'll schedule a follow-up in 6 months for routine lab work and to review the effects of the resumed omeprazole and any cardiac diagnostics from the Holter monitor. Should you experience any worsening symptoms or have concerns in the meantime, please do not hesitate to contact us.
Thank you, doctor. I appreciate you taking the time to go through everything so thoroughly. It's reassuring to have a clear plan in place.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I understand it might feel overwhelming to manage a condition that doesn't have a cure, but many people lead full lives with proper management.
What does management involve? I'm worried about the constant adjustments in medications.
It will primarily be about monitoring your symptoms and making adjustments as needed. We'll start with some medications to manage the symptoms and regular checkups to monitor the progress.
Is there anything specific I should do on my own?
Absolutely. Lifestyle changes can make a significant impact. For instance, a balanced diet, regular exercise, and stress management techniques can all help control your symptoms and improve your quality of life.
That sounds doable. What kind of support can I expect from your team?
We'll schedule regular appointments to review your treatment plan, and I'm always here to answer any questions. Plus, Our team can connect you with support groups where you can meet others with the same condition.
Now look at question 26.
I apologize for the delay in your surgery. We had an emergency that required immediate attention, and we needed to reallocate resources.
I understand emergencies happen, but I'm anxious about the postponement. What does this mean for my treatment plan?
We're rescheduling your surgery for next week. I assure you this won't compromise the outcome of your treatment.
Thank you for explaining. How should I prepare in the meantime?
Continue with your current medications and try to stay as active as your condition allows. And of course, if you have any questions or concerns, don't hesitate to reach out to us.
Now look at question 27.
Staying well hydrated is crucial for your health, especially given your condition. Aim for about 2 liters of water a day, though this can include fluids like tea and broth.
Is it possible to drink too much water? I often hear conflicting advice.
Yes, it's possible, especially if you have certain health conditions or take medications that affect water retention. We should tailor your intake to fit your specific health needs.
How will I know if I'm getting the right amount?
Your body gives you signs. If your urine is light and clear, it's a good indicator that you're well hydrated. Feeling dizzy or having a dry mouth are signs you need more fluids.
Now look at question 28.
Today, we'll focus on enhancing our hospital safety protocols to protect both our staff and our patients. One key area is the proper handling of hazardous materials. Another critical point is emergency preparedness. Regular drills and training will ensure everyone knows how to act in case of various emergencies. Lastly, we must foster a culture of safety where everyone feels responsible and empowered to contribute to a safer workplace environment.
Now look at question 29.
It's important to manage your medication schedule precisely. Use a pill organizer if that helps you keep track. Also, make sure to monitor your symptoms daily. If you notice any significant changes, you should contact us immediately. And finally, ensure you follow the specific care instructions we discussed, especially about wound care and activity levels.
Now look at question 30.
Let's focus today on improving our techniques for patient lifts to ensure safety and prevent injuries.
Agreed. We should also consider equipment upgrades if necessary. Better lift tools could help a lot.
Absolutely. Let's schedule training sessions for next week and review our current protocols. It's crucial that everyone feels confident and secure in using the lifts.
I'll look into the latest equipment and arrange for some demos. We need to ensure whatever we choose is a good fit for our needs.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we explore the rapidly evolving application of sodium glucose cotransporter 2, SGLT2 inhibitors, in the treatment of cardiovascular and renal diseases, extending beyond their initial use in managing type 2 diabetes. Recent studies have highlighted the potential benefits of these medications in a broader patient population, including those with heart failure, regardless of their diabetes status. SGLT2 inhibitors, originally approved for the treatment of type 2 diabetes, have shown significant promise in cardiovascular and renal disease management. These drugs function by inhibiting glucose reabsorption in the kidneys, which not only aids in glycemic control, but also confers benefits in heart failure and kidney disease through mechanisms that are still being elucidated. We'll begin with a case study of a 58-year-old male patient, referred to as Mr. Smith. Mr. Smith was diagnosed with type 2 diabetes 7 years ago and has been on standard metformin therapy. Recently, he presented with symptoms of chronic heart failure, including worsening dyspnea and reduced exercise tolerance. His medical history is notable for hypertension and chronic kidney disease, stage 3A. Given Mr. Smith's complex profile, the decision was made to introduce an SGLT2 inhibitor, dapagliflozin, based on its dual benefits for both heart failure and renal protection. This decision was supported by findings from key trials, such as the DAPA-HF trial, which demonstrated that dapagliflozin significantly reduces the risk of worsening heart failure and death from cardiovascular causes in patients with heart failure with reduced ejection fraction. The benefits of SGLT2 inhibitors extend beyond their glucose-lowering effects. Studies suggest that these drugs improve cardiac function and kidney outcomes through several mechanisms. These include diuresis and natriuresis, reduction of cardiac preload and afterload, and possible direct effects on myocardial energy metabolism. Over the course of 6 months, Mr. Smith reported improved symptoms and quality of life. His ejection fraction improved from 35% to 42%, and his renal function remained stable. These improvements are consistent with the benefits observed in clinical trials, where SGLT2 inhibitors have shown a reduction in hospitalization for heart failure and progression of kidney disease. The most recent research, including studies published in top-tier journals like the New England Journal of Medicine, has expanded our understanding of the role of SGLT2 inhibitors in cardiovascular health. For instance, the Emperor-Reduced trial corroborated the benefits seen in the DAPA-HF trial, showing reduced cardiovascular death and hospitalization for heart failure across a broad range of ejection fractions and diabetic statuses. These findings are pivotal for clinical practice. For patients like Mr. Smith, who are at high risk for both cardiovascular and renal complications, SGLT2 inhibitors not only manage blood glucose levels, but also confer critical cardiorenal protection. This class of medication should be considered a frontline treatment in suitable patients with heart failure, particularly those with a concurrent diagnosis of type 2 diabetes or kidney disease. The role of SGLT2 inhibitors in the management of heart failure and kidney disease represents a significant paradigm shift in how we approach the treatment of these conditions. Ongoing research and future trials will likely continue to expand the indications for this versatile class of medication, potentially improving outcomes for patients with a variety of chronic conditions. This concludes our session on the transformative impact of SGLT2 inhibitors in the treatment of heart failure and renal disease. We encourage healthcare providers to consider the emerging evidence in their practice to enhance patient outcomes in these complex conditions. Thank you for joining today's in-depth analysis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. Thank you for joining this session on addressing systemic inequalities in healthcare through policy reform. My name is Jeff Cedric, and I'm here to discuss the urgent need for a comprehensive approach to health equity. Today, we'll explore how policies can be designed and implemented to counteract the deep-seated inequities that disproportionately affect marginalized communities. Let's begin by considering the case of Mr. Thompson, a 58-year-old homeless man with type 2 diabetes and hypertension. Mr. Thompson's story is a poignant example of the intersection between chronic health issues and social determinants of health. Living in a shelter, he faces significant barriers to managing his chronic conditions, which are exacerbated by his unstable living situation and limited access to healthcare services. His story highlights the critical need for policies that not only address healthcare access, but also broader social determinants like housing, employment, and food security. Recent research, including articles published in Harvard's Health Policy Review, emphasizes that addressing social determinants of health is crucial for achieving health equity. For instance, ensuring that vulnerable populations like Mr. Thompson have access to stable housing can significantly improve their ability to manage chronic conditions in their own homes and reduce emergency room visits. This approach not only improves health outcomes, but is also cost-effective in the long run, reducing the burden on our healthcare system by enhancing residential environments. Furthermore, policies need to address the root causes of inequity. This includes tackling the disparities in education and employment opportunities, which are often predictors of health outcomes. For example, educational programs tailored to adults in underserved communities can provide them with the skills necessary to secure better jobs, ultimately improving their economic stability and access to healthcare. One effective policy measure could be the expansion of Medicaid to cover preventive and social services that address these determinants. By broadening the scope of what healthcare encompasses, we can ensure that individuals like Mr. Thompson receive comprehensive care that goes beyond treating immediate medical issues. Moreover, community-based participatory research, CBPR models show promising results in addressing health disparities. By involving community members in the research process, policies and interventions can be tailored to meet the specific needs of the community, ensuring that they are both effective and culturally appropriate. For instance, a CBPR project in a low-income neighborhood might focus on community health workers who are trained to provide both health education and assistance in navigating the healthcare system, which has been shown to improve health outcomes in marginalized populations. Tackling health inequities requires a multidimensional approach that includes policy reform, community engagement, and an expanded definition of healthcare. By focusing on these areas, we can create a more equitable healthcare system that meets the needs of all individuals, regardless of their socioeconomic status. Let's use the insights from Mr. Thompson's case and scholarly research to advocate for policies that address the root causes of health disparities. Thank you for your attention, and I look forward to your questions and a fruitful discussion on how we can collectively work towards health equity.